Niue now has 56 confirmed dengue fever cases, with 4 more new cases this week. The health department has confirmed that the strain present on the island is dengue type 1, a similar strain to the outbreak in the Cook Islands and Kiribati. There are apparently 4 strains of dengue, and health experts say that a person can be infected by at least 2, if not all 4 types at different times during a lifespan, but only once by the same type. The most severe of dengue types is dengue hemorrhagic fever that can be fatal if unrecognized and not treated properly. DHF is caused by infection with the same viruses that cause dengue mortality due to DHF can be less than 1%. Fortunately, thus far, DHF has not been detected within the cases presented at the hospital. The message from the health department is to remain vigilant, and the main focus is prevention by reducing exposure to mosquitoes, reducing the breeding sites, and use of mosquito repellents, coils, and mats. Niue's parliamentarians joined health officials and staff yesterday morning at the Whalefono for HIV/AIDS Awareness workshop. Even though not many of the parliamentarians attended the meeting, those that did were invited to exchange ideas on how best to address the issue and discuss how parliamentarians can encourage the public to be more aware. Niue's HIV/AIDS champion, Member of Parliament Talaisi Tamatalasi, said parliamentarians should be good role models and make decisions that can ensure the continuing positive steps health officials have set for the island. He said more educational awareness on the subject is a must if Niue wants to maintain its status of not recording the HIV/AIDS case on the island, and this is important with students who should be aware of the deadly virus. Asked if parliamentarians should lead by example and get tested for HIV, Mr. Talaisi said this is a positive set and parliamentarians should encourage this first approach. The subject, he said, is sensitive, but times have changed and more education needs to promote the reality of the deadly disease and avoid unnecessary fatalities. Niue is part of a study in an attitudinal survey on the delivery of HIV/AIDS and sexual reproductive health education in school settings. The study is being conducted by UNESCO in 4 countries that include Samoa, Palau, Niue, and Nauru. Robin Drysdale, a consultant contracted by UNESCO, has been working closely with the Education Department and Health, as well as discussing with key stakeholders in the education sector. We caught up with her today to find out about the consultations and Niue's needs.
Well, obviously it is a sensitive issue, but people also recognise it's a very important issue that young people need information about. And so far people have been very receptive to education happening in these areas. Education that's of course relevant to the year level and appropriate at different age levels, but there is a recognition that it's very important to have this education for young people in Niue. So this study is to find out what is currently happening and what the needs are, needs from parents' point of view, from parents' point of view and from students' point of view. But a curriculum that is implemented, for example in Fiji, in family life education, at primary school level you have things such as peer pressure and relationships, friendships, decision making, and also things on body development and puberty are appropriate things to have cover at primary school. Then in secondary level, starting to move into more work on puberty and body development, working more on issues to do with HIV and understanding about those issues, and developing programs around male and female reproductive systems, everything that's age appropriate for the different levels that they're at. But this will come obviously out of the study, recommendations will be made in terms of how to further progress things in Niue based on what the parents and the schools and the teachers have expressed is the need here locally.
Robin says that research shows that the school setting is an ideal place for accurate information to be imparted, and that school-based sexual and reproductive health education programs are valuable and have a positive impact on young people's health. The study has also raised some issues that are common across the board.
Some of the common issues that have been across the other countries in the Pacific have been that teachers feel they'd like more training in this area, also resources. They don't necessarily have enough resources to support programs they'd like to implement in the school. Also common is that parents would like more education. So it's not only the young people or the students that would like education, parents would also like education on how they can talk about these sensitive issues with their young people and how they can support them when they're also being taught in the schools.
UNESCO has also indicated their support to implement recommendations and help to mobilize resources, whether it be acquiring resources or training. Robin will be conducting similar studies in Nauru next week, and a final report from this study will be made available in July. Niue's health approach might have to look at divine intervention and beliefs in order to have less health ailments. That, according to heart specialist Dr. Bob Eason. However, Dr. Eason said the island's health status is in much better shape than those in New Zealand.
I guess, especially with the diabetes, we try and get it as well controlled as possible with oral tablets, but there comes a time when oral tablets just don't work any longer, and then people really need to move on to insulin treatment. If that doesn't happen, then what we see is people coming through with kidney failure and heart problems. And I know at Middlemore we have about 14 patients from Niue who are on renal dialysis because their diabetes hasn't been well controlled. And because they've been frightened or refused to look at the possibility of using insulin treatment when the tablets no longer work. So it is important. Having said those things, there are some things that are very positive with living here. I mean, just as important as diet and exercise and smoking cessation is feelings of happiness and love and general well-being and spiritual health. And sometimes those are aspects that feel a lot better up here than they do when you're trying to survive the southern motorway in South Auckland. So there are some aspects of life that folks seem to enjoy a much better quality of up here. There are some aspects like the diet and the diabetes and the obesity side that folks are well aware of in terms of the need to try and improve there. But in general, people seem to be doing pretty well here.
Though numbers are small, Dr. Eason said people need to address their diet and perhaps an approach to introducing taxes and policies change on goods by the government might address some of the problems.
There have been quite a lot of studies looking at different ways of trying to manage diet. I mean, we've had some big campaigns in Auckland, the Let's Beat Diabetes campaign, and unfortunately the result of that is that although people have all the information, nevertheless it's very hard to actually do the things that are required to reduce the risk factors. It's one thing to know that a healthy diet and lots of exercise will reduce your chance of getting diabetes and kidney problems and heart problems in the future, but it's quite another thing to stop doing the eating and the sedentary lifestyle that one really enjoys. I mean, it's a bit like smoking. I stopped smoking about 25 years ago, but I smoked for a long time as a doctor, knowing full well that it was harmful, but at the same time it was very pleasant. And in the same way, a lot of people know that by eating too much, and it is quantity more than quality that's important, by eating too much and eating till satiety, they will get bigger and bigger and their diabetes will get worse and worse, but it's actually quite difficult to stop doing that and to make those lifestyle changes. New Zealand's most unkind and poisonous exports to Niue are large tins of corned beef and packets of cigarettes. And certainly some countries, mainly in Europe, have looked at have actually implemented taxes on sweet drinks and particularly fatty and unhealthy foods, and that's one way of trying to force the issue. But if anything, in New Zealand it's moved the other way. The Labour government there introduced a policy whereby only healthy foods will be available in the schools. But then the current government says that that's too much like being a nanny state, and people should have completely free choice to do what they want when they want. And so all those regulations have been removed, and the responsibility has been put back to the individual. But it's easier said than done.
Niue has 14 patients on dialysis just at Middlemore Hospital, and that is a significant number for a small population. With many outpatients moving from pills to harsher forms of treatment, Dr. Eason also said the happier the person is, the better it is for their health. Work has resumed in Avaseli this week to continue with the European Union-funded EDF10 project. Work on the project began last year but was stalled due to some emergency work with power faults in Alofi North and Alofi South requiring urgent attention as well as weather conditions. The project focuses on energy efficiency with the renewal of aging power cables around the island that happens to coincide with the installation of new fibre optic cabling for telecommunications. We spoke with the EDF10 project manager about the status of the project.
We are just waiting on the telecom issues to finish in Avaseli. When the trench gets to Fuata, which is up near the Oniiki turnoff, EDF10 will then take over the work and telecom will come along with us, because the majority of the work at that point, from that point onwards, is cable, high voltage cable work. So, and compounding that problem to some extent is we have got a freeze on the funds, which are rolling over between financial years for the EU, and that is delaying the start-up of one or two things as well. Not so much the cable, but one or two other issues that we need to get on with. I'm hopeful that we would be up at Fuata maybe within another month. We've got some work to do, not so much EDF work, but telecom work through the Avaseli village, and people will see the digger digging there at the present time. There are one or two pieces of cable there, nothing particularly significant. Then we go up onto the top, or telecom will go up onto the top at Fuata, and from there we're away, and we should issue a contract maybe 4 to 6 weeks' time. But then I've been saying that for a long time, for nearly 18 months, and I really haven't been able to predict it any closer than that. But it's looking pretty good now, and our funds will be ready to go by then, and we should hopefully 2013, I think, is the final date. I don't see too many issues in swallowing the money that quickly. We have 30 gas stoves and 24 solar water heaters waiting in New Zealand to be paid for and to come up to the island. We have 5 containers of solar panels. That's a $900,000 project. They are on the water at present on their way to Niue and will be fitted up near the meteorological office at the airport. Once those projects land, then the payment for them will be due, and that will take a large chunk of the money out of the budget, fairly simply. Then it's up to us, of course, then to issue contracts for the cement and the levelling of the sites and the installation of the equipment. So I don't see any problem in swallowing the money that quickly. I think it should go fairly smoothly. I have also backstopped the project with overseas labour if it proves difficult for Niue to come up with the labour to do the job. So far I don't think that will be the case, but if it does happen, then we can bring some people in from overseas as part of the contract.
Paul says part of delays have also been due to the administration of funds on the island and through the EU, and also response times.
I've inquired why it takes so long, and I complained to the EU very early on in our process, and they came back and said they were very happy with the way the project was going, and they were quite pleased that it was going as well as it was, which to me didn't seem quite right. But it's their call, it's their money, and they decide how things are done. So we must do what they want, and in return that takes some time.
Another issue that the project is faced with is a labour shortage within the department that will be sourced on a progress-based contractors to assist with developments, but the project will provide support with areas requiring heavy machinery.
Part of our project management is to bring in 1 or 2 heavy items of machinery, and the ditch witch, as we call it, the thing that digs the hole, is free issue to the job. So that will be paid directly out of EDF funds and will be dedicated to that work, if you will. Then it's up to the contractor to decide if they need a front-end loader or a tip truck or something like that to go with it, and we can get that as part of the project. So labour and management are the 2 key issues we're looking for from people on Niue. If they can provide that, and I'm sure they can, then the job should go pretty smoothly.
It is estimated that the project will take 18 months to complete if there are no further disruptions. While some interesting observations and comments from the public about the cooler weather the island is currently experiencing, with temperatures in between 18 and 20 degrees in the last few days, The lowest was recorded this morning at 17.7 degrees, which usually expects just above 20 degrees for this time of the year. Sean Tukutama from the Met Department said the cooler weather means the beginning of winter or the dry season. The sudden drop is from a high-pressure system to the far southwest of Niue that directs a cool east to southeast wind flow over Niue. Niue has only 2 seasons, wet and dry. So if you're heading out to New Zealand tomorrow, make sure to take along a warm scarf as it is chilly in Auckland. And that concludes our news bulletin for tonight. We do hope that you have an enjoyable weekend ahead, especially to those teams who will be playing cricket over the weekend.